like glaucoma can cause visual field losses where the patient may not even recognize it. So a visual field test can be something as simple as a screening test, which we do at every eye exam, or we can go into a threshold visual field exam. So typically if we're looking for any particular areas of the visual field, which is our peripheral vision. So what the test includes is when you're looking straight ahead at a certain target on the test, you then tell us, usually by a button of some sort, when you see objects to the side or the periphery. So that screening test is going to be a quick, short, just real kind of, we just want to make sure you're seeing most of the points. And that's what we do. And let's say we see a couple misses, maybe it promotes us to want to take more of that threshold longer test. And so what that's really helping us determine is if there's any potential visual field issues in either eye. We do each eye individually, so as to not create some overlap there. And then that can share with us quite a few things. So there are a lot of conditions that can cause specific types of visual field defects. There are even conditions within the brain, brain tumors or traumatic brain injury that can cause certain types of visual field loss. Say for someone with a stroke, they can often have what's called a homonymous hemianopsia, where each eye individually misses one side of their field. So when they look directly at someone, they're only going to see one side of their face. They're not going to see the other side of their face unless they kind of move into the field they can see. So that can be common. And again, that's just giving us more information to that. Other conditions like glaucoma can cause visual field losses where the patient may not even recognize it. They wouldn't even really notice that right away. But if it were to progress or advance, then it starts to kind of tunnel in or close in. But early stages, there's usually patterns that we can see where the nerve has died off, and we'll see certain areas on the visual field that has deteriorated.
Would a healthy person who doesn't have any, let's say, diseases or brain injuries or anything like that, would there ever be reasons why they would have a visual field loss or, a poor visual field?
So again, we do a screener on everyone. So usually if there's a visual field defect of any kind, it usually kind of contributes to something. And so that's why we have to look, right? Mm-hmm. We have to kind of see, and maybe it's not anything vision or life-threatening, but it's still, we should all, be able to see all the points on that screening field without issue. But there are a lot of things that can cause that, so even someone who has amblyopia, or what's called a lazy eye, where they, developed and they grew up with one really strong good eye and the other eye just doesn't see as well. Doesn't mean they don't see at all. It just doesn't see as good as the good eye. And they may struggle to see that periphery a little bit as well because the whole eye just didn't develop to see as well. Right. So it doesn't mean it's, going to cause any tremendous issue. That's why we're binocular, but it still can cause some, obviously some defects on the field test itself.
Are there any other conditions that would be common to have, let's say, visual field loss? You mentioned stroke, you mentioned glaucoma, amblyopia. Are there any other ones that are kind of more common to have that side effect?
With diabetic retinopathy, again, you can have areas or what we call scotomas, or basically patches of vision where they're not seeing as well, or little areas. A lot of times too in the treatment of proliferative diabetic retinopathy, where now you get a lot of new vessels that are now so weak that they're bleeding. And when you do that, they do a laser procedure on the eye or on the retina. So then it's preventing any further vision loss, but of course the laser also does what it's supposed to do, which is stop that, but it also, kind of disrupts the retina as well. So you can have some vision loss from the laser, but it's all preventative peripherally so that you keep your center vision clear.